Good morning, everyone. Welcome to the Insurance Subcommittee on Life and Health. We have one bill before us this morning, and we are not required to have a quorum per se, so we're going to go ahead and get started. If I could have Senator Kirkpatrick, if you'll come forward. Yes, that's fine. Thank you. Very good.
You ready?
Please introduce your bill.
Thank you, Madam Chair. This is Senate Bill 20, and I've been working on some version of this bill for several years with a lot of different stakeholders. And the idea of this bill is to do two things. One is to help consumers be protected when they buy a product and they think they have access, but they actually don't have enough people in their network. And then the second thing is really very important, which is to give our insurance commissioner the ability to assess health insurance network adequacy and the tools to enforce their findings. There are new federal standards that started in January that have defined appropriate time and distance for by specialty and by population, and it's quite complex, but it does a pretty good job of spelling out what's reasonable. And so this bill is going to give our commissioner the ability to promulgate rules, which I expect will very closely match the federal guidelines. I did bring one thing for you, which is just showing, this is from a couple years ago, that Georgia is at the very top of narrow networks, and we certainly want to address that, but in my opinion, the best way to do that is to give our insurance commissioner the authority over this area so that they can assess the adequacy of the networks and then do what needs to be done if they find that there are gaps in the system or carriers that need some help beefing up their network. So I'm happy to go line by line if you like, but that's the gist of what the bill does.
Does anyone have any questions? Yes, please go right ahead.
Okay, thank you, Madam Chair. First, I want to say thank you for bringing this bill, and I really do believe it would help the consumers out there and different people who have health care. I wanted to know, have there been a major influx of complaints that require the reason we need this bill?
This has just been ongoing for years with consumers who are, health insurance is complex, and not everyone knows what they're buying when they buy insurance. And in many cases, the employer is making the decisions for the consumers. And so the commissioner's office does have a complaint process, but I don't really track their complaint system. I know that they do thoroughly investigate every complaint that they get, but this is just an effort to bring us into a better place with complying with the new federal guidelines and to improve access for consumers all across Georgia.
A follow-up?
Yes, please.
Do we have any type of penalty now at all?
We don't really, our commission really doesn't have the ability to, I don't want to really like to use the word police, but to address inconsistencies and gaps in the system. And so this bill does have that piece, and that is in section, that's on the last 2 pages, page 4 and page 5.
Okay.
Thank you.
Thank you.
Are there any other questions? I would like to see if there's anyone in the audience. Several stakeholders are here. Would anyone like to address the committee? Yes, please come forward. If you would come to the mic over here and introduce yourself. And anyone, if you represent someone, thank you.
Good morning. My name is Whitney Griggs. I am the health policy analyst with Georgians for a Healthy Future. We are a nonprofit policy and advocacy organization focused on being the voice of Georgia's healthcare consumers down here at the Capitol. And we want to thank Senator Kirkpatrick for bringing this bill. It is something that has been very needed to give Georgia consumers essentially what they pay for. When you enter into an insurance policy, you're entering into a contract and believing that you're getting access to the doctors that you need. We believe that this bill is certainly a jumping off point, but believe that it would really be strengthened by including some quantitative measures of network adequacy so that consumers know when their plan is in violation, they can have a yardstick to measure it against. Georgia does currently have network adequacy standards in law right now that use the words reasonable and sufficient, but allow the insurance companies to essentially police themselves and say what they believe is reasonable and sufficient, so consumers don't know if they're actually in violation of network adequacy standards. And we would also like to see consumer protections included in there. So when consumers are forced to go out of network due to a poor plan design, they're not forced to pay all of the out-of-network costs on their own, and believe there should be some measurable standards for that, but that there should be some consumer protections so that people aren't having to take on huge amounts of medical debt because they're not able to get the doctor that they need. Thank you.
Thank you. Yeah, just a moment. Okay, go ahead, Chairman.
Thank you, ma'am. To the author of the bill, thank you for bringing this to us, but so I can get this clear in my mind, are you saying you're wanting to kind of expand the narrow networks? Because a lot of the carriers, they'll have a skinny down network to kind of get the rates less. So if you have less people in the plan design, your rates are going to be less, and we have some consumers out there on these group health plans that's all they can afford. And when you're talking about skinning it down, it helps them get better rates. So if we just add everybody, the network's already very large. I mean, you look at Blue Cross's network, or United Healthcare's network, or Cigna's network, or Aetna's network. We only have 4 fully insured carriers left in the market. But we have all the hospitals and almost all the providers. So if you're going to require the insurance companies not to have the skinnier networks, our rates are just going to keep going up.
This bill changed a lot through the process, and we did take that into account in the substitute that you see in front of you. There was a lot more specifics in the bill about that, but our chair of insurance on the other side felt that there was a risk of actually doing harm to rural communities with the bill the way it was, with all the protections that were in it originally. And so what we have come down to, working with a lot of different stakeholders, including the industry and including the commissioner's office and the advocacy groups, is that if we can give our commissioner what he needs
So basically you're giving the commissioner more latitude to... Okay.
Yes, and the rules that the commissioner will write, I would be surprised if they didn't closely reflect the very specific guidelines that have just recently come out. And I believe they're here if they want to say anything about that.
Would you like to address the group? Please come forward.
Good morning, Weston Burleson with the Insurance Commissioner's Office. To Senator Patrick's point, first I want to thank her for bringing the bill. She's been working with us throughout the process. I'm sure she can tell you this bill's changed a number of times. To Representative Williams' point, we do have a lot more latitude in this draft. I know some of you may have even seen a presentation our office put together based on a study that we did that shows the networks really vary on what part of the state. Metro Atlanta's has pretty good coverage versus other parts of the state that might need some addressing. And so we appreciate the way the bill is drafted that lets us maybe not necessarily one size fits all process for the entire state, but lets us narrowly target different areas of the state just to make sure that consumers are getting the coverage they need.
The only thing we don't have in my area is like a Kaiser. But we have every network already. But anyway, Humana just got out of the business for everybody. So,
thank you, Chairman Hawkins.
Thank you, ma'am. To the House member, that's not the case around the state, and sometimes there's a fair amount of confusion. Most of the insurers are workable. We don't see problems with most of them. Every once in a while, there's sort of like a maverick, someone making a decision somewhere that kicks an OB out of network, and she may be the only B within 40 miles. So this type of legislation sometimes is to sort of rein in the outliers because those outliers can make a big difference on whether people get to care or not. I mean, if you've got to drive 90 miles and you're pregnant, you're probably not going to make all 12 appointments. You'll make the last one for sure, but you may not be in the hands of where you want to be due to the timing of it. But in the early 90s, this legislative body passed any willing provider, and that allowed docs to go into networks when sometimes the network said, we're full, we're not taking any more. Now, that is a way to narrow networks. And but I don't see that so much anymore. And like I said, most of our insurers are workable. I enjoy my time with some of the representatives here from the insurer groups. They're good people, and things go well. But every once in a while, just like with our hospital, United Healthcare and our hospital are back at negotiations.
They kiss and make up. I mean,
Yeah.
that's part of the dance.
Yeah, well, that's true, but the people who are dancing around the ones we really care about, and that's the patients. So if we do anything down here, we get anything right, it should be for them. And so I see this bill as helping patients, so I'll be supporting this bill. Thank you.
Could I add one thing, Madam Chair?
Yes, please.
The one thing that may help you, Representative, is that we did exempt the HMO plans in this bill,
Okay.
which typically is going to be that lower tier of cost. And so hopefully that will eliminate some of your concern about that.
Are there any other questions or anyone else want to speak to the bill? Okay, at this time I will entertain a motion.
To pass.
Do we have a second? Okay, all those in favor say aye. Any opposed?
No.
Okay. The ayes have it, your bill passes.
Thank you.
Thank you. We are adjourned.